Hi guys, so good morning, good afternoon, good evening. So whatever time you are listening to this, please pay attention. So welcome to the class, the first lecture for the first time in Parasite Management and Water Survival. So welcome. So let's jump right in. So ano yung matututunan natin dito sa first lecture natin? Oh, makikita niyo sa picture or sa video is the definition, the roles, objectives, needs and values, legal concerns, health and hazard and risks, prevention and protection. So let's go to topic number one. Topic number one, the definition of first aid. Sabi dito is, the keyword here is the immediate care. So if someone is injured or suddenly taken ill in English, so ito yung binibigay mo. Ito yung instant na bibigay mo sa kanya para to stop the bleeding if he is nasugatan. Ganun. So, ganun ang first aid. Definition niya. It includes self-help and home care if medical assistance is not available or delayed, especially for the far-flung areas or hindi kayo malapit sa sentro or hindi kayo malapit sa clinic or hospital. It's what you give to the people who is in need, who is injured. So, sabi dito is self-help. Pwede mong i-first aid yung sarili mo. So, let's now go to the roles of the first aid. Sabi dito, first, role means, if we compare that to the movies, di ba may mga role ang movie? Mga actor, uh, villain, starring, mga ganun. Yung first aid, 8 yan. So, 1, 2, 3, 4, 5, 6, 7, 8. So, sa number 1, it is the bridge that fills the gap between the victim and the physician. So, have you seen a bridge, di ba? Dinudugtong na yung from island to island or from place to a place. Di ba? So, kasi, uh, when you are may sakit ka, nasugatan ka ganun, hindi naman kasi nagte-teleport or nandyan agad-agad yung physician or yung doctor or any health worker. May parang there is a gap nga. Hindi agad-agad sila nandun para so kapag nasugatan ka, hindi naman agad-agad na meron si doctor para bigyan ka ng lunas. So, you must do first aid first before uh, going to the clinic or the hospital kasi ganun nga. There is a gap kasi. So, it is under number 1, it's not intended to compete with nor take the place of the services of the physician. Kumbaga, first aid is extra lang yan. Extra. Pero, doesn't mean na hindi na kailangan. So, yung physician pa rin yung doctor pa rin yung masusunod dito. So, it ends when the services of a physician begin. So, when meron na yung health worker, tulad ng doctor, pag meron na siya, hindi mag-end na yung first aid. Number 2, ensure the safety of him, herself, and that of the bystanders. So, first aid, hindi lang yung pagbibigay mo ng lunas na actual. Hindi lang yung physical na if first aid mo siya or lalagyan mo siya ng bandage or dressing. It is somewhat is a collective term na i-control mo yung situation. So, for example, may motor accident. Siyempre, control as a first aider, control mo yung situation para i-ensure mo na safe lahat ng mga na-aksidente or yung mga bystanders. So, that is a role of the first aider. Gain access to the victim, of course. If the victim is suffering from is in need of immediate help, then you must gain access to it, to him or her. Determine any threats to the patient's life. So, for example, nasugatan siya. So, i-determine mo kung uh, ano pa yung dapat mong gawin. So, dapat linisan mo yung sugat niya at lagyan mo ng iodine solution to prevent infection, di ba? So, you must observe the victims or the patient's life. So, so that maagapan lahat ng mga possible na tikitin sa buhay niya or ganun. Number 5, summon advanced medical care as needed. So, as you are conducting the first aid, as you are bandaging someone, na-bandage mo yung sugat niya, you must call for help. Of course, call mo yung ambulance or mga other emergency unit. Provide needed care for the patient. So, hindi lang yung physical nga, sabi ko. It is a collective term of care. So, hindi lang physical na care na ibibigay mo, kundi emotional din. So, para hindi mag-panic yung patient mo, you must assure him na okay lang, relax lang. Darating din yung ambulance. So, i-assure mo siya para hindi siya mag-panic. Especially sa mga patient or victim na in shock. Ano yung shock? We will discuss that on another video. Assist advanced personnel. So, when the doctor is here or mas magaling sa'yo na health worker, ibigay mo sa kanya yung control at i-assist mo na lang siya. Ganun. Record all findings and care given to the patient. So, as the advanced personnel na pumunta na tinawagan mo, sabihin mo lahat yung nangyari syempre. Okay? So, let's now go to the objectives of first aid. Actually, yung mga references ko is nagbibigay ng 4, meron yung 3. So, nilagay ko na lang lahat para walang away-away. So, sabi dito is preserve lives. Syempre. So, back to the example na sugatan siya at dumayo lahat. Nag-flow lahat yung dugo niya. If you will conduct first aid, then you can preserve that person's life to prevent further harm and complications. So, by applying iodine to that sugat or lininisan mo, you prevent further harm yung infection nga. Seek immediate medical help, of course. Provide reassurance, yung sinabi ko kanina. So, sa isang part naman ng objective first aid, alleviate suffering. Ito is lessen the suffering of the victim. So, when you conduct first aid, dapat maibsan mo yung pag-suffer niya or ang Tagalog man. So, to prevent added further injury or danger and to prolong life. So, let's now go to the need and value of first aid. So, parang combination yan ng objectives and roles. Sabi dito is to minimize, if not totally prevent, accidents. So, sabi dun sa roles is to ensure the safety of the people, di ba? To prevent further accidents, must take charge sa situations, especially pag motor accident yan. Magbigay ka ng mga indication na may accident dito, tumawag ka ng ambulance, mga emergency units to prevent added injury or danger. So, you must conduct first aid in a proper manner para you will not put that person in danger. Meron kasi yung improper conduct of first aid na it will further increase the suffering of that person. So, to train people to do the right thing at the right time. So, some first aid emergency or some emergency na maraming tao dun, you can summon their assistance. So, sabihin mo na, tumawag ka sir, pwedeng tumawag ka ng ambulance, pwede mo i-summon yung kanilang help. Accident happens and sudden illnesses are common and often serious. So, you must know how to do first aid kasi it's an emergency. You cannot predict an emergency, right? And it can happen anytime. And we are just human beings, so you must know what is first aid, and that's why you're here. That's why we will learn what is first aid. People very often harm rather than help. So, especially during crowded na tao, may na-injured na tao, yung bigla-bigla sinasabi nila na painumin mo, ganun. Bad. It's bad. Kasi walang basis. Hindi mo pa na-diagnose kung ano yung sakit niya. Parang agad-agad papainumin mo. Paano pag in shock? In shock siya. It's not advisable na painumin mo na tubig. So, ganun. So, actually, sometimes people hinder the application of first aid. Proper and immediate care is necessary to save life or limb. Sabi dito, proper and immediate. Dapat tama yung pag-apply mo ng first aid and dapat mabilis para maligtas mo yung tao. So, for example, there is a drowning victim. Anong gagawin mo? So, dapat, di ba, agad-agad na tulungan mo. Kung alam mong lumangoy. So, what are the characteristics of a good first aider? Dito yung observant, resourceful, gentle, tactful, sympathetic. Observant. So, you must know. O, you must parang identify kung ano yung injuries niya. Anong mga signs and symptoms ng injury. So, when you are observing at nakita mo na motor accident yan, do not just transfer the victim. Don't just recklessly move the victim kasi maybe may head and spine injury siya. Which if you move him or transfer him, his condition will worsen. Resourceful. So should make the best use of the things at hand. So there are mga first aid materials na hindi agad-agad available. You must be resourceful in doing this. In conducting first aid. So for example, may na-fracture na kasama mo. Tumalon siya tapos na-fracture yung kanyang paa. So saan ka kukuha ng splint? So any stick na hard, maghanap ka ganun. So that is being resourceful. Gentle, you should not cause pain. So while you're conducting first aid, you must not worsen the situation of that victim by being hindi malumanay, hindi ka gentle. Dapat gentle ka. Tactful, should not alarm the victim. So, you must parang i-explain mo yung ginagawa mo sa victim para hindi siya mabigla. So, for example, lalaki ka na first aider at babae yung if first aidan mo, dapat explain mo yung ginagawa mo habang first aid. So, para hindi siya ma-surprise. Baka heart attack siya sa ginagawa mo na pag-bandage sa kanyang injured part or etc. Edi, pangit din yun. Sympathetic should be comforting. So, one of the aspect of first aid or one of the collective care that you must give to that person who is a victim or a patient is reassurance. You must reassure that everything will be okay. So, the ambulance is coming. You say that. So, etc. So, that is the characteristics of good first aider. Punta naman tayo sa mga legal concern. So, meron yung consent, duty to act, standard of care, negligence, abandonment, confidentiality. So, always, parang before you conduct the first aid, magpaalam ka muna kung pwedeng tumulong or hindi. So, meron yung express. If ikaw, sa first aider, sasabihin mo, tatanungin mo kung pwedeng tumulong, yun. My name is Sean Rebo ngayon, a trained first aider, may I help? Kung sabing, oo, sige. Pwede mong tanongin yan sa victim or sa bystanders, yung mga taong nakapaligid sa victim. Implied, paano pag mag-isa mo at nahimatay yung victim? So, you can use this implied consent na baka siguro kailangan niya ng tulong. Kaya wag mo na lang express kasi nga sino yung kasi nga nahimatay, di ba? So it is your duty to act um, para to sa mga health workers and mga police, mga ganun, mga government workers, they are mandated to help the people, di ba? So, standard of care. So, what is standard of, ano yung standard natin? Dapat, ang first aid is proper and impartial. What is proper? This is not, proper means it is the the steps to, that is to conduct first aid must be correct. Hindi yung gawa-gawa lang niya na first aid. Dapat nakabase yan sa siguro sa Red Cross book or sa book na or sa mga ini-introduce ng mga organization na ganito dapat na gawin. Impartial. You must not parang you must apply first aid to all kinds of people, whether it's your enemy, it's your friend, it's a black woman, white woman, a Chinese. Dapat walang exemption dyan. Negligence. Ito yung one of the lack of skill. Di, nagkamali ka ganun. Dapat you can be parang makasuhan. You can actually you can be filed a case, you can be criminally liable if you are negligent in conducting the first aid. Abandonment. So, on Article 275, number 1 and 2, actually meron pang 3 yan, of Act 3815. Act 3815 is the revised penal code. So, you can be criminally liable, which means pwede kang makulong if pag may taong nanghihingi ng tulong at ikaw lang yung pwede niyang mahingan is if you did not help him or her, can be pwede kang makulong doon. So, assignment nyo yan, lalagay ko sa Edmodo klase nyo. So, ganun. Confidentiality. So, while you're conducting first aid, you must parang take his name, take his age, number, ganun. Lahat ng mga profile variables niya. And you must not disclose it to any people sa pupuntang advanced personnel lang. So, ganun. So, that is for the legal concern. Let's now go to the health hazards and myths. So, what is the hazard or ano yung bad na experience mo in the conduct of first aid? So, sometimes when you're conducting a first aid, you can get that person's illness. So, for example, ngayong pandemic, di mo alam kung may COVID yung victim or not. So, anong gagawin mo doon? So, there are steps naman. Meron mga steps kapag may COVID-19 yan. So, for example lang sa Boracay, merong na-heart attack or na-cardiac arrest. Nakalimutan ko na yung details. Yung ginawa ng Koreano, nag-compress na lang siya sa parang ginawa niyang modified CPR yung ginawa niya. Ulit-ulit. So, hindi siya nag-rescue breath kasi may direct contact. Kasi pag ganun. So, that is being also resourceful. So, there is a hazard, especially right now, pandemic, in the conduct of first aid. So, meron yung mga common transmittable diseases like mga bacteria, mga virus, ano ba? Flu, mga ganun. So, diseases can be transferred actually when you are conducting first aid. So, how does these diseases being transferred? Meron yung direct contact and indirect contact. Direct contact means skin to skin. Na ikaw, example when you are doing a rescue breath, so magan ka sa kanyang mouth, you can get his or her disease dahil parang may kinuha mo, may nakikontak ka lang sa skin mo, sa bodily fluids niya, ganun. Then that is direct contact. Pag indirect contact naman is hindi naman yung parang hindi siya person to person, na hindi siya direct, syempre hindi siya direct contact. So, parang in a way, in other ways, you get that disease. So, for example, measles. Ano yung measles? Yung parang nagre-red yung dito. Yung parang chicken pox, pero red siya. Kapag daw, if a person with measles in a room got out from that room, tapos pumunta ka, you can get the measles. Kasi yung measles is airborne siya. Pwede siyang yung parang kanyang pathogen, it can be, pwede siyang mamalagi sa air. Kaya nga airborne. Pwede siyang malagay sa mga molecules ng air. Molecules ng oxygen and any other air. So, that is for airborne transmission. Pag vector transmission naman, when an animal bites you, di ba? Tapos meron kang rabies. So, that is for direct contact and indirect contact. So, anong gagawin natin for this? Prevention and protection. Meron yung tatlong definition dito. Universal precaution. So, these are yung number 1 and number 2. Universal precautions and body substance isolation are parang system of protection para sa mga health sa hospital, parang guideline siya para sa hospital, or para sa mga health worker kung anong gagawin nila na protection para sa kanila to not get that disease. So sa universal protection precaution is parang yung highlight niya dito is prevention and transmission of bloodborne pathogens. So ano yung mga diseases na nakakos through bloodborne pathogens? Meron yung HIV and meron pa yung isa. Ay, HEPA ba yun? It's not HEPA. Basta, let's take na lang HIV. So, HIV kasi, you can transfer that through, for example, yung blood mo. Yung blood ng HIV patient. Tapos, parang may ginawa ka, parang you conducted care on it as a health worker. Tapos, yung blood niya is napunta sa sugat mo, sa health worker. You can have that HIV too. So, yung ginagawa is parang may ginawang guidelines to protect them from that. So, ganun, that is universal precautions. Meron din yung body substance isolation. Precautions taken to isolate or prevent the risk of exposure. Basta, when you talk about this too, it is a system of or a guidelines of protection against yung mga diseases that can be transmitted to them while they are conducting care. So, ganun. Ano naman ang personal protective equipment? So, laging nasa news yan, lagi nating naririnig, at baka nakita nyo na. So, have you seen a health worker on parang swab station? So, yung mga gamit niya, or sa hospital, mga gamit niya, bodysuit ba yun? Nag-mask lang siya, nag-mask siya, mga ganun. Parang suit siya, pero personal protective equipment. So, ipa-flash ko sa video. So, basic precaution and practices. Personal hygiene. So, dapat malinis yung kamay mo when you are, for example, is first aiding the sugat of your friend or a person you know or you don't know. So, you must have personal hygiene. Dapat malinis yung kamay mo. Generally. Or dapat malinis yung sugat. Example lang. Protective equipment. So, dahil nga. So, baka may magtatanong sa inyo, how will you conduct first aid, sir? Mahirap na ngayon. may COVID. Syempre, if if ever, um, try avoid, mga ganun. If may gloves ka, ilagay mo yung gloves mo as protective equipment. Dapat nakamask ka at nakamask din yung victim. And I think pwede na yun. Tapos may uh, face shield. Ganun. Equipment for cleaning and disinfecting, dapat meron kang alcohol, rubbing alcohol. Um, dapat you know the location of the running water. Betadine, iodine. So, ganun. So, basic lang naman. Basic precaution and practices. So, let's now go to the hindrances in giving first aid. Ano yung mga nag-hinder or nag-stop or nag-prevent in giving first aid? Tatlo yan. So, unfavorable surrounding. If parang malas ka sa environment, ganun. Mga crowd, mga tao. Tapos, sa victim mismo at sa kanyang relative. So, sa unfavorable surroundings, kasi if it's nighttime, you cannot see, then mahirap magbigay ng first aid. Crowded city streets, churches, shopping mall, on places where there are many people, it's hard to give first aid. Kaya kasi you cannot move well and tapos marami pang echapuera na mangingi pakialamera sa daan. Busy highway, if it's motor accident, kasi you're trying to give the first aid and parang stop control the traffic flow while you're giving the first aid. Cold or rainy weather, yes, lack of necessary materials or helpers. Mahirap magbigay ng first aid pag mag-isa mo. Punta naman tayo sa presence of crowds. If the crowd curiously watch, sometimes heckle, sometimes offer incorrect advice. Yun nga yung sinabi ko na bibigyan mo agad ng tubig, ganun. Sometimes it doesn't help the victim. Okay? So, sometimes yung mga crowd, the bystander, is mga pakialamerang mga yan. Kung ano yung sinasabi nila sa first aider na kung ano yung gawin. So, the first aider must not listen to them and must compose himself so that yung alam niya, yun yung alam niya sa first aid na dapat tama, yun yung dapat niyang gawin. They may demand haste in transportation or attempt other improper procedure dahil nga pakialamera yung mga sometimes yung mga bystander or yung mga tao na nakapaligid sa aksidente sa motor, bigla-bigla na nila na pag meron na yung ambulance, ginaganon tapos nilalagay sa ambulance, which is wrong kasi dapat i-assume muna na merong head and spine injury yung aksidente sa motor. So, when you do that, kapag bigla mo siyang i-transfer kasi, pwede siyang mamatay actually. Kapag may nagalaw dito, sa spine and head mo, generally speaking is pangit. Parang can kill that person. So, we must be careful in transferring that. So, they demand haste. So, meaning, nagmamadali sila dahil daw time is gold, parang ganun. So, you must take time to in conducting first aid. You must follow the proper rules, proper procedure. A good examination is difficult while a crowd look on. So, the first aider must compose himself not to be pressured by these people. And lastly, lastly, from the hindrances, there are pressure from the victim or relative. So, number one, talks about kapag the victim is drunk. So, if the drunk person, kasi if you're conducting a first aid on drunk person he is not on his right mind. So, it's hard to give him a first aid. Try talking to a drunk person, di ba? Magulo. The hysteria of relatives of the victim. So, meron yung, for example is, nawalan ng, nasugat yung isang member of the family, tas nag-faint siya dahil nawalan ng dugo. Yung tong other family members is parang nagpa-panic mode sila kasi nahimatay ganun. So which they may hinder yung pagbibigay ng first aid na uh, they will parang pressure kung ano yung gagawin ng first aider. Parang papanik silang mamamatay na siya which is it will pressure the first aider in giving first aid. So pero first aider must calm also yung mga family members. And ito yung which is bad. The first aider, if he does not compose himself, may follow what is the people are saying. So if he does that, he may improperly conduct that first aid, which is will hinder the first aid. So, yun lang for the hindrances. What are the cloth materials used in first aid? So, marami yan actually. But meron pang, sa first aid kit nga, meron pang iodine, betadine, clean cloth, ganun. Pa ba? And others. So, nilagay ko lang dito yung dressing and bandages. Dressing, you can use yung gauze, yung may gauze. And especially sa bandages, yung gagamitin pala natin in our lecture is the triangular bandage. So, that's it. Ganun lang. So, I will be posting your first quiz after you have watched this one. So, thank you for listening and have a great day.